Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. We will be discussing its benefits and also its risks. What are its benefits? First and foremost, it is minimally invasive. If you are someone who is experiencing anxiety just at the word surgery, then UAE can be an option for you because UAE is very minimally surgical. And then it preserves the uterus, so you're not cutting down the uterus or you're not taking down the uterus like in hysterectomy where the whole uterus is removed, right? So there is no harm to the uterus, and it can help if the surgery is performed in a proper manner and the results are coming as expected. Then future fertility can be expected. Apart from that, typically it's a very short hospital period time. The recovery time is very short because it's very minimally invasive, and also there are good success rates, and also the symptoms are relieved. So these are the certain benefits you will be obtaining from UAE. Now let us see the imposed risks in this UAE. So what are the risks? Remember that if you're someone who's looking for treatment options, it can be any disease, it can be any form of treatment. The pros and cons should always be watched, right? So if your benefits outweigh the risks, then that is a better treatment option. But if the risks outweigh the benefit, then that is a poor treatment option. Here the risks are many. First and foremost, there is abnormal bleeding. If the surgery does not go as needed, there can be abnormal bleeding from the fibroid, and suddenly if the blood supply is cut off, the fibroid can change into a red degeneration. It can start becoming infected also. So there can be abnormal bleeding, there can be severe bleeding, or there can be stoppage of this bleeding, and there can be infection symptoms. So abnormal bleeding can occur, there can be occurring injury to the uterus. How can this uterus be injured in this? Remember, we are cutting the blood supply of the fibroid. Remember, these capillaries can supply even to the other parts of the uterus, right? So if you are cutting the blood supply of that part, the uterus will be harmed, and the uterus is harmed, it can go into necrosis. Necrosis is death of that tissue or death of the uterus, and if the death of the uterus occurs, it will go into putrefaction, which is bacterial infection, and then the uterus has to be removed, and then there is no future pregnancy. So if the outcome of the procedure is not proper, then there can be injury to the uterus, and there can be infection of the uterus, and also there can be infection at the punctured site. Wherever you're puncturing that femoral artery, remember it's an artery and not a vein. So if you're puncturing the artery, there can be infection even in that puncture site also. And if it is not done properly, and if you are having coagulation disorder, and if it is not priorly checked to the UAE, then that can cause a lot of blood to ooze. And also if it is not clotting properly, that blood clot or that blood will start pooling inside the thigh area, which can lead into hematoma. And the artery can be injured if not done properly. Remember, femoral artery is a very important artery in lower extremities. If that is injured and if that has blood clots, then it can shift somewhere, and that blood clot can travel throughout the body, and it can fit somewhere in the organ capillaries, and that organ can be damaged, which is one of the riskiest complication of this UAE. Let me explain to you through a picture. So what happens here if the fibroid is here? Okay, we are cutting the blood supply, right? So this is done. But what we are doing? We are harming the femoral artery, right? So whenever we harm this femoral artery, there can be a blood clot forming inside the artery. And remember, it is artery, so blood pressure will be more. Whatever blood clot is there, whatever blood clot has formed here can get dislodged, and it can shift and come and block the liver capillary. It can block the brain capillary, it can block the heart capillaries, or it can block the stomach capillaries, or anywhere else. It can block anything. So wherever it is blocking, that will go into death, or death of the tissue can happen. So if the embolus, that is the blood clot, is going and getting stuck in the heart, then it can cause heart attack. If it is going and getting stuck in the brain, then it can cause paralysis. If it is going and getting stuck in the liver, it can cause necrosis of the liver or of the stomach. So the complications, the threatening complications are a little bit on a riskier side of this UAE compared to the normal hysterectomy or this myomectomy. So here is where risk of this UAE is a little bit more complicated. Apart from that, what else are the risk factors? Infertility. As I told you, if that embolus is attaching to the other capillaries, if the embolus is not directed properly and is attaching to the other capillaries of the uterus, it can harm the uterus, and wherein the uterus death can take place and there is no fertility issue itself. And it can cause loss of menstrual period. Sometimes it can cause ovarian dysfunction. So if there is ovarian dysfunction, then it can cause amenorrhea or menopause like symptoms directly. So there can be premature menopause. There can be allergic reaction to the contrast material using in the embolus, which can cause anaphylactic reaction, which can lead into furthermore hospitalization. Blood clots, we have already discussed about it. Other than that, what are the other risks? Let us see. In some women, especially 90% of the women will be experiencing severe pain and severe cramping type of pain after the surgery. We have spoken to a lot of gynecologists. They suggested that many people do suffer from pain and cramping after UAE, but usually they do suggest painkillers. But remember, the painkillers also have certain side effects, right? And also, apart from paining and cramping, you will be having vaginal discharge. Sometimes if it is a submucosal fibroid and it is very small, it has a stalk attached to it, and after blood supply is cut short, the stalk can detach, leading to the falling of the fibroid through the vaginal orifice, or it can cause a lot of vaginal discharge as well. And there can be nausea, vomiting, low grade fever, fatigue and discomfort. All of this come under post embolization syndrome. So these are the risks of UAE. If you're someone who is experiencing fibroids, or if you're experiencing bulky uterus, which is thickened uterine layer, endometrial layer, or if you're experiencing endometriosis, adenomyosis, polycystic ovaries, dysmenorrhea, any of the female reproductive problems, we have high success rates. So we have two types of consultation options here at Fidicus Homeopathy. One being the offline consultation or the in-person consultation option. If you're staying nearby the nearest branch of Fidicus, you can come and consult us in person. If you're staying very far from us, you can contact us online through audio consultation option or through video consultation option. After consultation, if there is any need for investigations, we will let you know. And if you are already done the investigations, you can share it with us. After all the process has been done, especially online clients, medicines will be delivered to your home. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying elsewhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, message us on this number. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're experiencing fibroids, or if you're experiencing any of the female reproductive organ diseases, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have 3 principles which we strictly follow. The first and foremost one, the main reason for doing this video, because of we are having high success rates, and also the patients who come to us are asking a lot of different questions. So in order to educate them and also to educate people, we are doing these videos. We're having good success rate with this fibroids, bulky uterus, it can be endometriosis, it can be adenomyosis, especially polycystic ovaries, or also severe dysmenorrhea. Apart from that, the transparent treatment here at Fidicus, because there is no gray area between the patient and the doctor, the prognosis of the case will be clearly discussed to you. And the personal care here at Fidicus is top notch. You can experience that because we are doing these videos just because our patients have asked us different questions and we wanted to educate them, and also we have wanted to educate people. So the personal care here at Fidicus is good. We will be educating you on all your queries, and if you have any sort of doubts regarding your condition, if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.